So, the new COVID-19 mRNA vaccine by Pfizer has been approved through emergency use authorization by the FDA and has been approved by the CDC as well. The vaccine is now cleared to be used throughout the country, but supplies are limited. So, who will get to use the COVID-19 vaccine first? What's up, San Antonio and world? I'm Dr. Qasim Butt, and I'm a kidney doctor, and I'm here to break down health in a simple way. Now do me a favor, hit that like and share button. It'll really help me out. Supplies of the new COVID-19 mRNA vaccine are limited. So earlier this week, trucks and cargo planes were packed with the first 3 million doses of the vaccine and deployed to all 50 states. To help guide the distribution, the CDC's advisory committee has recommended releasing the vaccine in 3 phases. Now, these phases have to do with the availability of the vaccine, meaning initially we see that we'll likely have the vaccine in limited supply, and over time there'll be more vaccines brought to market and different types of vaccines brought to market. Phase 1 is when the vaccine will be in limited supply. Phase 2 is when there will be a large supply of the vaccine, and phase 3 is when the vaccine will be available in almost surplus. Phase 1. Initially, when the vaccine comes out, it will likely be in limited supply. In that case, we have to concentrate our efforts on the most crucial. So therefore, phase 1 will actually be divided itself into A, B, and C phases. Phase 1A. This is the highest priority group. This will include people in the medical profession, the healthcare workers, including doctors, nurses, nurse practitioners, hospitals, clinics, and all supporting staff. This phase, interestingly enough, will include long-term care facility residents, which actually includes nursing homes, assisted living centers, skilled nursing facilities. So, healthcare workers, y'all probably understand, right? We come in direct contact with COVID-19 patients and are the most at risk. But long-term care facilities, why? Because these facilities actually have one of the highest rates of COVID-19 transmission. And in fact, 40% of deaths in the US from COVID come at these facilities. That's right, 40% of the deaths in the US come from long-term care facilities. Phase 1B. This includes all non-healthcare essential workers, including police, firemen, educators, food, transportation, utilities. Phase 1C. This includes older people, the seniors, people over 65. But this group also includes patients with high-risk medical conditions. Phase 2. This is when large numbers of vaccines are available. This is when this will entail the widespread distribution of the vaccine to all adults across the United States, and to kind of clean up all the crucial ones that were missed in phase 1. Phase 3. This is when we will have sufficient supply or surplus of the vaccine. We will make sure to vaccinate all the stragglers that were left behind, but also be time to reassess the situation. And at this point, we'll think about integrating the vaccine, the COVID vaccine, into routine vaccination programs. These guidelines from the CDC are not binding. The states themselves are actually responsible for the distribution and may change it accordingly to their own needs. But for the most part, phase 1A has been universally accepted. So you may want to check with your actual state to see how the distribution will go locally. Let me know what you think of the new COVID-19 mRNA vaccine and how it's being distributed. If you found this video helpful, please like and share it. Oh, and you got something to say, leave comments in the comment section below. And remember, it's your kidneys, your health.